It's a big welcome from all of us on the For You and Me team. We really enjoyed doing these studies, and we also enjoy doing these Zooms because it gives us descriptions, perspectives, insights that you just don't get otherwise. So this is Zoom call 2, and the today I'll do a little bit of a review of why For You and Me and why this particular study. I help lead the efforts here at For You and Me. And then Sarah and Emma will go through introductions. We'll go through aspects of where we are in this study, and eventually roll into the most important session, which is looking at open discussion and feedback. So to do that, the first thing I would say is a certain fraction of the people who are on today were on the first Zoom call that we had. And if you get interested, you will be able to download these slides, and you'll see the link in case there's something that we zip by. I'm going to do that intro that I did on the first Zoom call a little faster, but still do one for those who hadn't been on before. But I want to start with this. We're in a really strange transition where the ability to make insights and things that could be helpful to people, including those that are driven by AI, has become commoditized, commercialized, and a lot of misuse. Almost everyone has an Aura ring. This is a recent little note from Aura on their new meal advisor. And it is, I'm not getting down on Aura specifically, but a lot of our world assumes that there are things which others have that will tell us personal things about what we're doing, powered by cutting edge artificial intelligence, etc., that are really BS. And at the same time, there's been wisdom around for a long time that is probably as helpful as those things are. But it's in that context that we, a nonprofit, For You and Me, have been trying to figure out how wearable smartphones were able to give insights to people. And notice what it says there, and I will show this later, is for individual forecasting. So it's not just saying you as this is going to happen to you as a group. It's individual forecasting, and even more importantly, we really enjoy empowering individuals, families, to be able to do things that sometimes they're alienated from doing, like asking why do certain people have certain roles, and can people have more empowerment themselves. And for all this, our data, findings, algorithms, apps we put out there for others to use. There are a number of feasibility studies. We went past 10. We're now headed to 12 current feasibility studies. But the phrase is feasibility. We're interested in figuring out how can we learn from doing a study, not necessarily get to some definitive pronouncement and not a commercial product. Again, you can look these up. Have been doing a lot of publication to get information out into other people's hands. So then why this project? Well, this project was started by Tanya Simonelli and ourselves because there were a number of rare as one groups which would often say, sometimes that we feel as if we know more than the doctor we go to. Sometimes people who we go to think it's in our heads. And it was really the rationale was to empower patients and families to have a better idea of getting symptom portraits, and even more importantly, to be able to explore them. And the goal for the end of the project at the bottom, this is important because I think we've had a number of questions. What's going to happen at the end of the study? These beta tested apps that were coming through to the study ending at the end of June are not poised to be commercial products. They're meant to provide a path by which groups, either rare as one groups or CZI or new groups, could use those features in all the apps. So even if apps had features that weren't ones that were in your particular app, but all those will be available to be able to move forward by any groups that wish to try to find better ways to do patient-centric ways to follow a disease. Throughout it all, luckily, this one project generously funded by Jan Zuckerberg, we and our tech partner AgileOps, and of course, the 5 Rare as One groups, each of which at least one of them you probably know well, but I doubt you know all of them well. And as we've moved it through these 4 or 5 prototype apps with Android and iOS versions for virtually all of them, have gotten us to a point now where we have been doing this beta testing that Sarah will talk about. And importantly, it's not just a phone, it's the phone plus various devices. All are on the Aura app. I'm not going to go through because I think by now each of you know why we use the Embrace Empatica in some studies and the Lumia in others. But just know that that was very carefully thought out by the Rare as One group. So in this co-design concept, we asked, what do you want to follow? What do you want to have on the pull down screen? What do you want to do that? And then the participants themselves have been going, I like that. I don't like that. I wish I could do that. And with that, Emma, I'd like to turn it over to you and please introduce yourself and the others on the team.
Hi, everybody. I'm Emma. I am the voice that enrolled you in the study. Thank you so much for joining on this Saturday afternoon. And please, as we go, feel free to put questions and feedback at the bottom of your Zoom screen should be a Q&A option. Even if it's not a question, you can still put feedback there. So you can do that as we go. You can also add questions at the end, and we'll try to go through as many of those as we can. Again, thank you so much for joining, and let's go to Sarah, our lead research scientist.
Thanks, Emma. Really great to meet everyone on the call. I don't have a direct participant-facing role, so I don't get to interact with each of you, but I am behind the scenes running the study with Stephen. I do get to hear from you indirectly on our calls with all the research coordinators, and I think what I like most about this work is hearing from you and your experience in this work. And so it's a pleasure to be on a call with you to hear from you firsthand. Thank you, everyone, for joining us on a Saturday. There's no great time for these calls, so I really appreciate you getting on and giving us some time.
Sarah, do you want to hand
Yeah,
it over?
we'll hand it over to Paul.
Paul, just quickly before you go in, I just want to make a note that 3 of our coordinators are on this call and you'll hear from them. But unfortunately, 2 of our coordinators were unable to join today. So you won't be seeing their faces. Their faces are on the website if you want to see what they look like and you weren't able to join the first call. So we have Janae, who is the coordinator for my pancreatitis, who was unable to join. And we have Maddie, who is the coordinator for RVCP, who was unable to join. I know they wish they were here. And if they are your coordinators and you have any questions about the call, they will obviously have the chance to watch this recording as well. So feel free to, reach out to them. And then Paul, go ahead.
Hello, everybody. My name is Paul Gordon. I'm the clinical research coordinator for the PCD arm. Thank you all for joining us today. I've been having a really good time getting to meet you all, and I've been enjoying our interactions. Enjoy the call, and if you have any questions for me, just let me know.
Hi, everyone. My name is Daniel. I am the research coordinator for the long COVID arm. I've had the pleasure of working with several of you already, and I look forward to your continuous feedback and your ideas.
Hello, everyone. My name is Carissa Poku. I am the clinical research coordinator for the myosarcoidosis arm. It's been a pleasure being the coordinator thus far, just engaging with participants, whether it's with daily life or just hearing about your experiences and your feedback. And I hope that we have a great end to this study.
Should I go?
Unfortunately, Robin and Christiana, go ahead. Sorry.
Hey everyone, my name is Christiana. I'm a senior clinical research coordinator here at For You and Me. I'm not working on the CZI studies, but here to make sure the Zoom goes smoothly, and nice to meet you all.
And unfortunately, Robin and Diane, you won't see them today. Robin works behind the scenes as our senior data analyst, and Diane, you might know from all of the packages you've received came through her hands. So she's a vital part of the studies as well.
All right, Stephen. Okay. Wonderful. So for those of you who joined our past Zoom call, we're going to do a little bit of a repetition in some of the content, but we're going to breeze through just to get all of the newcomers up to speed. So I wanted to give a little bit of definitions around what we mean by beta testing, and this might be intuitively known by many of you, but what this really is testing completed by end users outside of the internal development teams, outside our investigator and research staff team, and is intended to be the end user recipient of that tool. So you're testing out a prototype tool in a real world environment to find bugs and issues and provide feedback on the tool's usability and functionality in your unique context. So what we're hoping that your role as a beta tester in the study is to use the app and the associated devices, try to break the app, use it to its fullest capacity. Think about how the use of these digital tools are useful or not useful for your unique condition and your unique life scenario as well. Tell us what you like and you don't like, and tell us what you wish the app could do differently that it couldn't do currently. I'm going to go to the next slide, Stephen. Just a few more definitions. When we say app bugs, what we're referring to are problems with existing features of the app, or if you're seeing error pop-ups, for example, when you're trying to sync your Aura data, for example, or if you're trying to complete a survey, if the app crashes for some reason, and also if the surveys aren't functioning properly, if you're not able to select certain items or the filter logic's not there, typos, etc. Those are all bugs. When we say feature modifications, we're more referring to suggestions to improve existing functionalities of the app. So for example, the compass chart feature or the I've noticed entries where you can tag momentary experiences. And also we're very interested in hearing whether there are additional features that the app doesn't currently have that you would like to see that could be useful for following your condition and tracking things over time. Next slide. All right, so to give you all an update on where we are in terms of resolving bugs, for those of you who weren't on the prior Zoom call, we had an alpha testing phase before we started this beta testing study. So we did some testing internally to try to catch a lot of the quirks. Of course, we did not catch everything. And so thank you so much for catching many of the bugs during these past few months. So since study start up until about mid-April, we have identified over 200 bugs that have been resolved. And there's more since mid-April too that we're still working on. We wanted to give a few examples of the bugs that are now resolved that we hope that you see in your app now that are not irksome issues. So one of those is the Aura syncing error pop-up you may have found when you were onboarded onto the app, and when you tried to connect to your Aura account, this little error pop-up comes up. You click OK. It seems like something's wrong and you're not connecting, but you can still go on. This error was a complex error that took our technology partner a little while to figure what the root cause of that issue is, but that error should be resolved now. So if you ever are disconnected, I'm hoping that you don't see that error anymore, but please do let us know if you do. But it may be from a result of a different cause. There were some errors and quirks in the surveys. Some of the dates were a little bit quirky. It was hard to implement dates sometimes far into the past. The medical history surveys had some quirks in terms of the response option functionalities and the filter logic. One in particular I want to highlight that we flagged and should be fixed now for the myosarcoidosis app. You weren't able to select multiple organs or multiple areas, and sarcoidosis is of course a multi-organ, multi-system condition. So it's very important to be able to select those. So thank you so much for that feedback. So that's just one example of how important those bugs are to report back to us. And so that should be fixed now for future folks enrolling into using this app. Tasks disappearing before they should. We heard this report from a few of you. Thank you. This is a really complex bug also to try to troubleshoot to identify the root issue. But this should be now resolved. You should be able to, for example, the quick activities daily survey, you should have the whole day to complete that. It shouldn't be disappearing midday, for example, and then it should be refreshed the next day. If you still continue to see issues like this, please do report them to your research coordinator. And finally, old tasks stacking up in your feed and task section and not expiring. This was a big one. Thank you so much for bearing with us. I completely appreciate it would be irksome to open up the app and see this long backlog of tasks that you're never going to be able to get to. The tasks are supposed to have an expiry, with the exception of the baseline one-time surveys that you only have to complete once. So they should disappear after a few days if you miss a weekly or biweekly survey. They shouldn't stack up like that. This is another complex bug that our technology partner did identify the root cause. So for new incoming tasks, they should expire when they're supposed to. But we appreciate how irksome that should have been when you're opening up the app. It's nice to complete your tasks and have a nice clean feed task section. So thanks again for bringing that to our attention. All right, next slide, Stephen. Okay, and we just wanted to highlight a few new bugs that we're aware of, that we're working on. And again, thank you for your patience in seeing these bugs when you use the app. So as we roll out new features, sometimes when you change one thing in the app, this is like the golden rule from developers. They say never change the app once you start a study, once it's live. And that this is kind of the opposite of that during this beta testing study. We're changing the app all the time. We're rolling out new releases. So when that happens, sometimes new bugs can pop up that weren't there before. So one that we're aware of is the reflections feature error pop-ups. The reflections feature recently became live. There's this error that pops up when you try to enter a text note. To get around this error, you should be able to just click OK. And then if you select edit, you should be able to write a text note. So it's not impacting any functionality in terms of writing a text note and having that note saved. However, we appreciate it's annoying every time you try to go in here. So this is something that our technology partner is working on to try to resolve. For the RVCP app, you recently should have seen the new pain survey that has the map of the body. There are a few issues with this. We just want to highlight this is version 1 of that pain survey. So we're working on making that more usable. So stay tuned for that next version that will be coming out. The notifications feature, this is another complex bug that our technology partner is working on. So that hasn't really been functioning well since it's been implemented as a new feature. So just stay tuned. We're hoping that you'll have prompts soon to remind you to complete your surveys, but it just turns out it's a much more complex bug than we had anticipated. And for the apps and for the cohorts that are using the mirror spirometer, you should have seen the mirror spirometer assessment for the past few weeks now. We're aware there's a few issues with this assessment. So one is connecting via Bluetooth, and another one is a task timeout length. The task doesn't give you very much time to complete your breath. So thank you so much for all the feedback that we've been getting on this. Again, this is think of these assessments as versions. So this is the version 1 of this task. And we're troubleshooting the timeout length and the syncing issue. It may be how the app is communicating with the server on the mirror side, and so we'll continue to troubleshoot that and just keep communicating with your coordinators, and they can give you updates on that. So we appreciate your patience. So we know it's quite clunky in its current version. And finally, Aura Ring disconnections. This has been happening over the past month or so. Another complex bug that we're trying to troubleshoot and understand the root cause of. So keep just checking. If you go into the settings, you can see which devices you have connected. And we've also been hearing there's errors. That error pop up sometimes is coming back up when you try to reconnect your Aura Ring. Your coordinators can see if you're connected on the back end. So just keep communicating with your coordinators and stay tuned again for solutions for that annoyance. Thanks, Stephen. You want to go to the next slide? Okay. So we wanted to give you a summary of where we are on implementing and taking your feedback in terms of feature modifications in the app and actually making those real changes in the app. So from the beginning of the study to about mid-April, we did an exercise of collating all of your feedback reports. So your research coordinators connect with us weekly. We have a long tracking file where they document every piece of information that you give them as a suggestion to modify or improve the app. We went through that list. A number of those items were duplicates, which is great because it tells us what is important across many participants. We got rid of those, condensed the list down. There were some things that we just knew that we weren't able to do because of platform constraints and certain elements, resource constraints, etc. And we came down with a list that we shared with all of the RARES1 patient advocacy groups, and they then did a prioritization of all of your feedback. And this ultimately came down to 10 key app suggestions that are currently being implemented into the app. And we're anticipating that these should be completed by July 1. So what we hope is that you can actually see some of these changes in the app. Some that may have been your suggestion. We're planning on doing this exercise again around mid-June, where we're going to collate all of your feedback again, and we're going to pare down a list of app modifications that will be implemented into July. You unfortunately won't get to see that version, but they're still really important, and they're going to fuel improvements in the app for the next iteration. Okay. We wanted to give a little bit of context on what types of app modifications are hard versus light. So if you, and in the next slide, I'm going to show you some of those key suggestions from you that we are implementing. And we don't want you to feel like your suggestion was ignored. Just want to give you a bit of context as to why certain modifications are hard versus light or not doable. We received a lot of very useful feedback on the walk and gait task revisions. And these tasks are, to give you some context, they are pulled from a platform called Research Kit, where it's actually not possible to modify specific components of the task once you start that task. So for example, we know it's very irksome to not know exactly when the walk and gait tasks are finished. It would be great to have an audio reminder. The task is now complete. For some of these tasks, you have the phone in your pocket. And unfortunately, unless we built these tasks from scratch, from the ground up, we can't alter these existing platform constrained tasks. We are working towards providing better instructions at the beginning before you start the task. That might help a little bit, but that's just one example of a task that we know is irksome, and we unfortunately can't make modifications to the exact task that you're using. But all of your feedback has been useful to reconsider using these tasks or something else in the future. Color coding and labeling options for the I've noticed entries in the log and the compass was a suggestion from some of you, a fantastic solution actually. To put in complex labeling options is a bit of a hard lift from the tech partner side, but we have a solution that I'll talk about in a little bit where you'll be able to select from selection of emojis that you might be able to use emojis as a labeling feature instead. And we hope that might be useful for you. Adding pictures into the compass is another great suggestion, but with the time that we have and the resources is quite a big lift on the tech partner side. So that's a bit difficult to do in this short time frame. And we've also heard from a number of you that you'd love to be able to respond to the quick activities multiple times a day. Again, a fantastic suggestion, something that we definitely will work towards implementing on a future version of these apps, but it's a bit of a hard lift for this initial time frame. Things that are light, we received a lot of comments on color contrast improvements that we're working on improving during this time frame. Increasing the character limit of the I've noticed text entries is another one that we can definitely do and we're working on. And also adding new surveys or modifying existing surveys with new content. So we heard from some of you, I'd love to be tracking pain on a daily level and the quick activities. So we can certainly do that and are trying to implement those changes. Next slide, Stephen. And this is a summary of some of those key modifications that we are implementing from your feedback. So the labeling of the I've noticed entries through emojis, one thing I touched on. Some of you have commented also on certain factors that you'd love to be able to track, like food intake, like weather, for example. We'd love to be able to track these things passively, but for the meantime, we're going to provide you with a drop down of emojis where you might be able to use the I've noticed feature, and you can use an emoji, for example, to track food intake throughout the day or to track the weather for the day. Or you can use it in any way that you want. So we're hoping that this solution, albeit takes a little bit of extra time is an interim solution, so you can track certain things that you would like to. And eventually the I've noticed entries will be overlaid on the compass chart, so you can follow those, emoji labeled or however you plan to label those factors over time, overlaid with those symptoms that you're following. We are implementing many color contrast improvements. The MyPCD app, there is going to be a second version of the mirror assessment where you will have a triggered prompt that tells you when you've had a change in respiratory function relative to your own personal baseline. So you can stay tuned and talk to your coordinator a little bit more about that in the future. That's not live yet, so that don't expect to see that in the app yet. For those active tasks, the walk and gait tasks, for some of you folks who don't feel like completing those or don't feel well enough to complete those tasks, it's annoying to see them in the app, and we've heard that feedback from a number of you. So we're working on including a skip button where you can just skip it all together. You don't have to see it. I want to turn this feature off, and I don't want to see it in the app. So that's one thing we're going to be implementing soon. The daily survey, those quick activities, we've heard some feedback that it'd be useful to be able to note whether the symptoms are in relation to your condition or in relation to something else that's going on in your life. So we are adding an option to the quick activities that you can select. It's just a checkbox. Check if this is related to my condition, or check no, it's not. This is related to something else that's going on in my life right now. We're increasing the character count increase for the I've noticed and reflection entries. And finally, we're adding in some new surveys. We're adding in daily pain for some of the groups. And so for the My Pancreatitis app, we're adding a daily hydration item. And we're also planning on adding in the Bristol stool chart so you can track bowel movements over time as well. So thank you again for all that extremely helpful feedback for all these changes. Next slide, Stephen. And this is just back to the first Zoom call. We promised that we would provide written answers to all of the Zoom call questions that we didn't have a chance to get to on that last Zoom call. I'm sorry this took so long, but there's a link here and to a password protected page on the site that you can go on and see all of the answers to those questions. So please access that link. And it may be actually, I'm not sure if it's going to be sent out by your coordinators, but they can certainly.
I think Sarah will have all the coordinators send out this link, so you don't have to worry about trying to click it here.
Great.
Or in the recording.
Great. Thanks, Emma. Okay, next slide, Stephen. Okay, and I'm almost going to pass it over to Stephen. I think this might be my last slide. We wanted to highlight a few questions in advance that hopefully will answer some of your questions that we've been seeing coming in. One is the compass chart new feature. So a recent version of the compass chart, and I meant to put a picture in here, but I might be able to show you here. There's a new button now that you should all see called Configure Chart. It's just right there. And if you select that Configure Chart, you now should have a drop-down menu of certain symptoms, not just from the quick activities, but from the devices that are using. You should see some Aura data in there, like an Aura sleep score, or steps for some of you, or heart rate. You might see some spirometry results from the Mirror device if you're in that cohort. You might see some results from the Empatica device, and you might see some output from Lumia as well, depending on which cohort you're in. And so this list looks different for each of the cohorts. When you select that Configure Chart button, you can pick up to 4 data streams or symptoms that you can track over time, and then those data streams will be presented in your compass chart. You might have to refresh that when you open the compass charts. You might have to, if you're having troubles, I would recommend just going back into Configure Chart just to make sure that you have the symptoms and data streams selected that you would like. There's some quirks with this. Again, it's a new version that's coming out, so please do continue to send reports back to your research coordinators if you see any issues. We've been receiving questions on with some of the devices like Empatica that doesn't return much data back to you. So for the My Pancreatitis and the My Long COVID app users, you should be able to see some of the Empatica data like skin conductance, the EDA signal, in your compass chart now. And we hope that will be useful for you. And if you're not seeing that, please let us know. The reflections versus I've noticed feature, I'm not going to go into detail into that right now because Stephen's going to give you some more details on those features, but we've been hearing lots of questions on what is the difference between these two features. So we're going to get into that detail in a bit. And then finally, the mirror assessment. Well, I think I covered that a little bit already, actually. So we're hearing a lot of feedback from you on the syncing, the Bluetooth syncing issues, and the task timeout. So we're working on those issues. Currently, though, I mentioned there's another version coming out soon. I'm not going to get into detail on that, but currently, there's really no way to track the the values from the Mir spirometer in its current version. So some of you are asking, how can we access these data in the current version of the app? In the current version, the quick answer is you can't, unfortunately. So we're working on making that more meaningful for you, but just stay tuned and you can talk to your coordinators about that once we push out future versions. All right, I think I'm handing it over to you, Stephen. I don't think I have another slide.
Okay, great, great. Thank you very much. Super job. I hope people found that helpful. I'm going to say a couple of things before I go off this slide that Sarah was using to go into the last section. They include the following. Um, I I hope that what's become apparent is that your cells, the essentially 50, around 50 people in each of the 5S1 group, are doing something that I don't think anyone is suggested to do, which is not to have separate beta testers, but to have the individuals who the apps are being built for using them and changing it. And the reason I bring that up is that usually in a study, the most important thing to collect is the data that a researcher uses to write a paper about this is happening, that is happening. That is not why we're doing this study. I think you can tell the reason we're doing this study is to hone how to have apps that are what people need to follow their own health. And so the most important, I think you can see where I'm going. The most important thing is these descriptions, these insights that you provide to the study coordinators, you pull in. And as the formal study ends, that month plus afterwards, there'll be some more changes that are made, but we're headed towards Sarah and I and others putting together a paper that will come out, which is just sort of a guide the world on where we have gone and where they might go. So I'm bringing this up because every time you make a comment as a participant and it gets logged in and we work with it, basically get a big smile on our face because these insights that you're coming up with are ones that I don't think we would have otherwise. So that's point one. Second, on the reflections in the I've noticed, I am about to go onto the compass, but I want to pull this apart. For a long time, there was just the I've noticed, and the I've noticed was to say in the moment, is there something that I want to tag, I want to label that could be something that I want to remember or that another person might be interested in. So the I've noticed feature has been there for a while. The reflection feature for most of you was not something that you had available. So I want to sort of compare, contrast that. Reflection is the end of the day dialogue with yourself, thinking of why is this happening instead of in the moment trying to capture something. There's a different sensibility dialogue you have with yourself. So the reflection is something where it's more contemplating what is the cause or the reason or what to work with. And that's still not clear, make sure you work with your study coordinator. Last thing before I go off this to the other is we learned on Friday, and Daniel was just finding out about this, that for the MyLong COVID group that's in the Lumia subarm, that Lumia has a transition. These happen when we have partner device companies that they're going to make, and we might have a gap in the long anticipated integration of the Lumia data into our app and their device. And so I'm giving you a heads up because I don't think that Daniel, you're knowing about it at this point would have made it there by Monday for those who hadn't had a chance. So just a little on Lumia. All right, so then I'm going to go into this last section, which is I think that, well, the hope is that when I get done with this, you'll have a better sense of what to do with a compass. To do that, I want to go back to a previous study we did a fairly large study, over 500 individuals, women who became pregnant, and we followed them all the way to after up to 6 months after delivery. And we had a number of devices on those individuals. And we were interested in saying, could we track 7 symptoms? Notice not physiologic symptoms, but could we track fatigue or cognition? And could we see what was happening to those? This is the paper that came out with Sarah as the lead author. And what we got out of it at an aggregate level, so this is the key phrase, aggregate. At the aggregate level was that most of these women had, and to be on this curve and percent, and I cut off the percent, but imagine this is 20, 40, 60, 80, 100% like this. Severe issues in fatigue or cognition or nausea to be, showing up on this curve. But these fit pretty well with what's in the literature. Next slide is why I show this. We call these spaghetti plots, whether it's heart rate variability or fatigue or deep sleep or awake. That black line that's in the middle is what was on that other curve, right? So that's the aggregate. But hoping what comes across is any individual, sorry, any individual who's on there is coming and going with much higher frequency changes than just the average. So the point here is, on any one day, anyone, whether it's with pregnancy or another disease, may have symptoms that are coming and going at a high frequency that if you were trying to forecast or predict what is going to happen to them, how could you give them advice on what was going to happen to them? You would not easily be able to do it. You might be able to do it for the aggregate, but not for the individual. So it's chaotic at the N of 1 level. So over the last series of feasibility studies, we have been originally thinking, and I think most of the world still does, that the way to understand a disease is to have researchers study individuals and do those apps and that data going to the researcher. And then I think starting 3, 4, 5 years ago, we realized getting that doctor-patient interface was good. Here, giving the data to the patient. But this is really the first study where, for diseases, we were interested in building a tool that allowed an individual to say to myself, I wonder if I had my meal at a different time, or I wonder if I did this activity, or I wonder whether I did this, would the symptoms of my disease for myself, not for others, but for myself, get better. So that's why we built out this thing called a compass. So this is, the heart of the whole study. And what goes into that, and you've been getting little pieces coming in, quick activities came in first, but in addition to the passive data and surveys, you notice that we started putting in these pause and added an information like I've noticed. The ability to tap someone on the shoulder because we've seen something change is what's called we've noticed, and these evening reflections. So these are all adding up to trying to do, if you give individual participants slash patients an ability for them to go, I'm at the helm and I'm going to see what happens to me when I do this. That is the compass. And why did I go through that? I spent a long time on that. Is we think that any of your feedback on how could we improve, how that works for you. So now knowing how important it is to see if we can evolve a way where you are the explorer and what does it feel like, is something that we're at the beginning of a journey on, and we're not knowing yet really how to do it. And so I wanted to take that time as an encouragement to try that compass feature, talk to your study coordinator, and give us very direct, blunt feedback on that. And this is sort of an example of where someone was following their or sleep score and steps and anxiety and daily survey. And just from those of us who are researchers using the compass and device recently before it's been put out, I think has an opportunity to go, I don't know if this works for anyone else. And I, in some ways, don't really care. I want to know, how is it that I can modify my symptoms? I hope that explanation helped you. And if it did, I'm going to turn it back over to Sarah, to the whole team. And I think we're opening up our, for the last third of the call, our discussion of, did that spark any comments in yourselves? Was there anything that you'd like to ask us? And what we'll find is, the questions that we can't get to, we'll do the same thing we did on the first Zoom call, and pull them in, answer them, put them back onto a website. And so I think the one explanation that I think Sarah or Christiana, maybe you could give is, how is it that people who want to ask questions will be able to send them to us? And
Everybody should see the Q&A button on your screen, and I think somebody has already figured it out. You can ask your questions there, and we can answer them live, and they will also save, so we can answer them in the same way that we did from the previous format.
And you won't be able to see other people's questions, and your questions will come in anonymously. So feel free to send feedback, good or bad. We won't know who you are. And other participants will not see your questions. So please ask anything that you're thinking. Don't just assume that it will be asked by someone else.
your
Thanks.
coordinator won't see, when you say, I don't understand why my coordinator does this. No, I'm just kidding.
And we just had one comment. Once the daily reflection started working, the I've noticed feature stopped working. This is from the myosarcoidosis arm. So thank you for that. So as I mentioned earlier, sometimes when new features are pushed out, other features sometimes get wonky. So thank you. Please do note that to your coordinator, and we'll make note of that now also to make sure that to make sure there's any troubleshooting there. But the I've noticed feature should still be functional through the little plus sign. And if it's not, something's wrong. And just
Also,
give
questions
folks a
about what
little bit
is,
of
yeah,
time.
just one quick thing. Yeah. Also, any questions about how the app will be developed after the end of the study? Any questions about what you're doing with the devices? Emma, while we're waiting, do you want to say something about the exit interviews? Because we'll be hearing it in general, but we've got enough people on that it might be valuable, Emma, to make a comment of this concept of exit interviews and why do we do them?
Yeah, so I mean, I think everybody should know or be aware that the study, we're just about at the 1 month left mark. And I know you've been having these really great check-in calls with your coordinators every couple of weeks, these biweekly check-ins. Your final check-in will just be kind of a jumbo check-in. It will be, we call it an exit interview, and it'll be really an opportunity to provide your overall feedback and comments about your experience in the study and your experience with the different devices and your in the study app. I think we will try to do those in the final 2 weeks of June. So you might have your exit interview a little bit before your actual end date. You can just continue to participate, using the app and your devices for the last week or two after your exit interview. But your coordinators will reach out to schedule those in the same manner that they have been, and they'll give you more details about what those exit interviews will look like. But on your end, they will just be, very similar to the check-in calls, just a little bit more like overall your experience.
We have a few more questions here. Thanks so much. The RVCP app doesn't allow to answer few for some questions. It only gives none several most of the time. So thank you. We've received a few reports of this. For the surveys that we have control over, thank you so much. We're taking all this feedback and thinking about how we can improve the response options. Some of the surveys that we use, like the Patient Health Questionnaire 9, the PHQ-9, and the GAD-7, the Generalized Anxiety Disorder Questionnaire, those are standardized clinical measures where it's a little tricky to change the response options if we want to use these in their intended manner. However, that doesn't mean that the response options aren't clunky and annoying. So thank you for that feedback. I can't remember exactly which survey that corresponds to, but we'll take that back. Thanks. The next question, the Oura ring told me something major may occur, and it did. Wow, it wasn't my disease, but it is a serious issue that I'm getting medical treatment for. It's fantastic to hear that the Oura ring is functioning well and useful for use. It's more of a comment, but thank you. We love to hear these comments as well. Um, Another comment.
Just one quick thing on that. I'm sorry, before you go off, but and Sarah, you can add to this. One thing that didn't come up there, but we've heard it as questions sometime is, I think any suggest. Remember, I started with the Aura Ring saying AI powered. Just please remember, and I used to work as an advisor at Aura, so I know their stuff pretty well. There are always as suggestions, and I think those companies and we would always want to make sure that it's as something to consider, not that it is found something that is certain. So Sarah, do you know what I'm saying? I think like for all the times when any device is showing something, remember it's a device that's trying to help give you peripheral vision, not direct guidance.
Great, thanks, Stephen. And the next few are just really comments. Thank you. I love, Stephen, your explanation, encouragement for patients to become the explorer. Thanks so much. Those are really great. That's great feedback. Right. Is there a way that my care provider can log in to monitor the health information collected from the Aura Ring? I think it might be useful for them as well. Yeah, again, to Stephen's point, you can use the Aura Ring features and data. I don't want to say at your own risk, but it is intended to be suggestions. You can access the data through Aura on the web, and you're happy you can share that with anyone. But to Stephen's note, the current stage of these features and we tend to say, take the results that you're receiving in the Aura app with a grain of salt, because the data is not validated necessarily in unique patient populations. It's really validated in a general population, healthy sample. So you may find that the scores that you're receiving, for example, the readiness scores, or the stress scores, the sleep scores, might seem off to you, or it might be useful for you. So it's just you have to take it individual by individual. But there are ways to download the data on the web if you want to share that with other folks, and your research coordinator can maybe help with that if you have questions on how to do that. Do you have
And
anything
Sarah,
else?
I'm going to put you really on the spot, but you're leading a study coming up in the fall on perimenopause. It's like totally awesome for giving women a chance to have a better sense of what's happening to them 35 to 45. But why am I bringing it up is not as an advertisement or a trailer, but Sarah, in there, do you want to describe the concept of sharing with others what you have found and the concept that we'll not do in this project, but in that study of being able to find others who might be like you and how we're trying to do that? Because I think people would enjoy hearing like a minute on that, like
Yeah, and well,
extending these features.
that's something that we ran out of time, but we were hoping to pilot test actually in this project. We've been planning to do this in several projects where it's useful when you're tracking your rebel data. Everyone has a burning question: what does my data look like compared to others? Are there others who have similar scores to me? Do they have similar symptoms to me or similar experiences? And so we are trying to build out ways in upcoming studies where we can where you can see other research participants' data, and you might actually be able to be connected with participants who have similar data to you. And then the idea there is to connect you with others that might provide support, who are experiencing similar things that you are. And the mechanism through which we're doing that, we're still working on, but that idea of building community, sharing data with others, and not necessarily just with your doctor, but with other people who are experiencing the same condition, with your family members, with whomever you want to, is definitely something we've been hearing and we take very seriously. I mean, we're working towards implementing that in future studies. And the perimenopause study Stephen mentioned is probably going to be the first one that we're going to pilot test that approach out.
And I'm sorry, one other quick thing. I know you've got another question, but this is important for people, I think. I think we're going to have the feature that allows you to take the things on your phone and put it on your computer by the end of June. Is that correct? Right. So you remember
I don't know. No, Stephen, I'm not sure if that's going to be a functional component until after July,
but it
unfortunately.
will
And I
come out of
wish, I
this
wish it
study, I
was.
think, right? Yeah, I think it will still be a feature that comes out of this study, even if it isn't
Yes, yes,
completed by
by
the idea.
July. Yeah.
Yeah, because we felt as if it's pretty hard to use the size of the phone to follow these things. So the developers have found a way to reflect it up. So when you're on a larger computer screen or something like that, or your iPad, and you want to follow it, you should be able to like reflect that over to there. And whether it's done or not by July 1, I don't know. Back to you, Sarah.
Okay. There's a question. I continue to see the medications follow up from April in my feed. Yeah, actually, this is a really great point. So it looks like they're not expired, as mentioned earlier. So the fix that we implemented, unfortunately, the fix is for new incoming surveys. So if you had surveys that were already in your feed and task section that you haven't completed, and you had that backlog, we didn't have a mechanism to remove those. However, I believe though, Stephen, Jules, who's with our technology partner, I believe they are working on a fix to actually clear out the feed and task section that hasn't been implemented yet. So the current fix is that new incoming surveys repeating surveys should expire when they're supposed to. They won't build up. But if you already had that backlog, unfortunately, that's still going to be there. So again, I know that's irksome. So the expiry fix is just for those new measures, and I hope that that helps with that question. Okay, so for the RVCP, it would have been nicer to have a class on all that the Aura Ring could do, adding meals and activities I've never done. I'm not tech savvy. It would have been helpful to learn how to get most from it. So again, just to back to what Stephen was mentioning, the Aura Ring and its associated app, you can certainly use that to your fullest. But in using the Aura app and interpreting what Aura is giving back to you was not an expectation in participating in this study. So we really were anticipating that you would interact with our study app. Of course, your coordinators can give you some helpful tips and insights into what certain features within the Aura app mean. But it really wasn't an expectation that you use the Aura app on a daily level in addition to the study app as part of your participation. Do you have anything to add to that, Stephen?
No, I don't think so. You said it very well.
How does this app compare to symptom trackers, et cetera, that are already on the market? You
Let me
want to take
take
that
that
one?
because I think aren't I correct that like in 4 days we're gonna have a review? Um, there are a number of devices that are tracking primarily for health and for athletes, things that might help you in what I'd say is just general living. And those are coming along. Very few of them are really actually aided at all, even though they say it by AI. The thing that I think is the opportunity, I was just at a conference this last week, is having it for particular diseases where those symptoms are the ones that you're following, not ones that normally are about just general health. And in particular, I'll just amplify what was said earlier is I don't know what the number is, but so I think there are now something like 40 or 50 data feeds and on the order of a very large number of quote symptoms across all the 5 apps, right? So not just in one app, but across all the apps that we will put and make available to anyone who wants to build that out further. And what we're trying to do is empower the rare disease groups to build things out where often those companies that are trying to make money are not as interested in the sort of small markets. But I think over time it's going to become possible to have a way to almost like design your own custom app to follow your symptoms. That's the eventual direction that will go. I think we're getting close to the end. Do we have
Great.
like one or two questions, then wrap up?
Yeah, I'll just take we have a few more. Are you planning to analyze oxygen saturation data collected from the Aura Ring app? in the myosarcoidosis app. I'm trying to think. So unfortunately for the myosarcoidosis, I guess Aura would track daytime SpO2.
Did you
Well,
mean
actually, sorry,
nighttime?
to take it back a step from this question. So the purpose of this study was for really beta testing these prototype apps. So we weren't anticipating to make any deep insights from the data from this initial set of data collected. However, into the future, we would hope to derive more insights from the actual health-related data that we're capturing. For the myosarcoidosis group, I don't believe that we had intended to track oxygen saturation, but certainly can think about that for the future and how it's useful for this condition. Will the surveys show up on the Compass? Hoping this answers some questions for a few different people. So some surveys will. Just to give a little bit more context, and I think we probably only have time for just this last question. We worked with the Rare as One patient advocacy groups to define a set of key symptoms or data streams from the wearable devices that would be most important to you. And that doesn't mean that that's the right list. And so we certainly want to hear from you whether that new drop-down menu from the Compass chart is a useful list for you, and whether you think there might be important factors there. And unfortunately, no list is going to be right for every individual person. And for future iterations in the app, we are working to creating personalized symptom trackers where you can choose what you want to follow, and then that can be displayed in the Compass chart. And I think that's a really important feature that we would hope to roll out in the next iteration, because we're never going to get this list right. But some of the surveys, like the quick activities, I think for some groups, like measures to some of the depression measures, like the PHQ-9, measures of anxiety, I think from the GAD-7 are showing, but it's different for each cohort. So you take a peek, again, if you go into your chart and you select the configure chart button that you should be seeing, you'll see a drop-down menu of surveys and some of the wearable data that you can select up to 4 to follow over time. So I hope that's showing up for you and that you're able to follow those.
And just a reminder for those of you whose questions didn't get asked, or just in general, all of these questions, even the ones that were answered, we will send out responses to, and your coordinators will also send out the written responses to the first round of questions from the first Zoom, which also might address some of these as well.
And you know what? There's just 2 left I can do really quickly. One of these is really a comment to me, and my comment relating to the surveys and the awkward response options. And just mentioning that perhaps we can give this feedback to the developers of those surveys and questionnaires. Absolutely. This is a fantastic comment. You are right. We do not need to continue to use surveys and that are clunky and that are not relevant. So I appreciate this comment, and you're absolutely correct. We should be reinventing the wheel, if you will, if it's not working. So thank you. I appreciate that. And then finally, there's one more down here. What does the PROMIS survey total score mean? So I think quickly, there's 2 PROMIS surveys. PROMIS is just the name of of a specific symptom survey. There's a PROMIS sleep survey, and there's also a PROMIS pain survey. So I'm not sure which one you're referring to, but the total score is just it's a count of all the questions that you responded to. So higher scores indicate a higher severity of that symptom. So it's a higher severity of sleep-related impairment or a high severity of pain-related disturbances in your daily life. So I hope that answers your question. I think that's all we have
Gary,
time.
that was
That was
brilliant.
it, actually.
That was brilliant. And yeah, I want to make sure we think. But Emma, do you want to take us out and close this then, Emma?
Yes, thank you everybody for joining, and happy June.
Thanks so much,
Thank
everyone.
you.